Hello, everybody. Welcome to tonight's presentation on insulin resistance and PCOS. If you guys can hear me, would you mind just giving a hey, I can hear you in the comment section as we get everybody into the presentation here tonight. We'll get started right away. I'm on time this evening, which is great, and so are so many of you, which is fantastic to see. This presentation is going to be on insulin resistance, PCOS, and managing your weight. We are also going to be talking about what the research says in terms of pharmaceutical options for these conditions, as well as natural options for these conditions too. There is the chat section, which I'm going to pull up so I can see. You guys are here, you can hear, amazing. Before we get started, I'd love to hear where you guys are from. So if you're comfortable with it, share where you are tuning in from this evening. I love to see it. I love to say hi. I will be monitoring the chat. I might leave the questions till the end this time so that we don't get distracted and overwhelmed, but you're welcome to post your questions in the chat box. We have lots of individuals from all over North America. Hello, hello, US, Canada, love to see that. Thank you guys for joining, and I hope you learn a lot. Make sure to post your questions as we go. If I don't answer them, I will get to them at the end of the presentation too. Hello, everybody from Canada and the US. That's awesome. All right, the other question that I have for you guys before we dive into the material here, how many of you are interested in knowing if you have these conditions? So right, interested. If you're wondering if maybe this is something that applies to you versus individuals who have been diagnosed. If you've been diagnosed with one of these two, put diagnosed in the chat. And if you are interested or wondering, put interested. Okay, so we have a combination of diagnosed and interested. All right, fantastic. So let's dive right in to our presentation this evening. So you are in the right place if you have PCOS or have been diagnosed with insulin resistance. We're going to talk about what these two things are and why we're doing the presentation as both together, because they often can influence one another. You're also in the right place if you're struggling with resistant weight loss. I see insulin resistance as one of the top contributing factors for individuals with resistant weight loss, and it can be a lot more challenging for these individuals. And unfortunately, a lot of people are just told, lose weight, that's why you have this, which is not the case, or lose weight, everything will get better. But it's really hard to do so. We're going to talk about some tools and strategies to make it easier. Another common symptom of these conditions would be oily skin or recurrent acne, as well as darkening around the neck. So skin that's darkening around the neck can be another sign of insulin resistance. We often see irregular or infrequent or absent menstrual cycles. We're going to talk about what a menstrual cycle is, what should be occurring, and what happens when individuals have PCOS. Excess facial hair, body hair growth is also another sign that we're seeing, as well as hair loss on the head or thinning on the head, typically the male pattern, so seeing hair receding from the hairline. So who am I? For those of you who don't know me, my name is Dr. Breanne Kallonen. I'm a licensed naturopathic doctor. I have multiple licenses and private practices. I also practice telemedicine around, which is really great to be able to connect with many of you from far and not where I am, which is great. I have a Doctor of Naturopathy degree as well as a biomedical science degree. And while I cannot give specific medical advice to your specific case on this webinar, I do want to educate and empower you to understand what's happening in your body. I do find that individuals who can be empowered and understand, and it's your health history, you have the right to understand what's going on. We often see these individuals be much more compliant with treatment options, and then their symptoms get much better. I'm also the author of the best-selling book on Amazon, Wild and Free, and creator of the Metabolic Reset program. I will be mentioning some lab companies in this presentation about ways that you can get access to appropriate testing if you're having some obstacles coming in your way, but I have no affiliation with those lab companies. And I'm a big proponent of informed consent. So my role is to educate you on what's going on, as well as all of your options, both the pharmaceuticals and natural approaches. So there's benefits and risks of both. And the best choice for you is the one that you feel you have all of the information to make that informed choice. What are the statistics with PCOS? It is the most common endocrine disorder of women of reproductive age. And these statistics vary in terms of the amount of individuals that are impacted by this. PCOS would be specific to women, although insulin resistance can impact anybody. So our current statistics say on average 8%, although the alarming statistic is 70% of individuals with PCOS often go undiagnosed. They're not aware of it. Why this is because most commonly when young women start their menstrual cycle, if it's irregular, they're often just told go on birth control. So they're not taking the appropriate steps to diagnose and understand why the cycles are irregular in the first place. And many women don't understand or don't know that they have PCOS until they try to come off the birth control pill and have all these symptoms, or they try to come off the birth control pill to get pregnant. Whoa, too fast. Back up. So the signs and symptoms we talked about as well: weight gain, resistant weight loss, acne, oily skin, or hirsutism, which is facial hair growth. So hair growth on the upper lip, the abdomen, the chest for women, irregular menstrual periods, so cycles that you're missing or cycles that are longer than 35 days, infertility, and hair loss on the upper head. Now again, insulin resistance can cause these hormone type changes too and create some of these hormone type signs and symptoms that we're seeing. We're also going to talk in this presentation how to be properly tested and assessed for PCOS. So what are the labs that should be run and what those ranges should be. We're going to talk about why weight loss is particularly challenging and tools and strategies that you can use to maintain a healthy weight. Before we get into the weight loss strategies, I really want to emphasize that weight is just a symptom that something else is going on underneath, or weight loss resistance is. The weight management is not necessarily the problem, it is a symptom. So we have to treat the underlying cause. We also really want to emphasize and remember that weight doesn't define your health. So we have to look at your labs to understand, is this impacting you or not? When insulin resistance gets better, many of the other blood markers get better as well. We're going to talk about how we can manage weight, whether it's pharmaceuticals or natural options to reset your own system so that you can have really good levels of blood sugar and insulin so your hormones get better. We're going to talk about what the research says on nutrition as well as supplements that you can consider utilizing. Before we dive in, I want to educate you on the hormones and what happens when we have a menstrual cycle. So there's this really interesting association between our brain, primarily the pituitary gland, and our ovaries. The menstrual cycle is defined by two phases. The first phase, typically the first half, so 1 to 14 days, is the follicular phase. The second half, defined after ovulation, around day 14 to 28, is the luteal phase. If your cycle is not 28 days, that is okay. There can be a plus or minus with a regular menstrual cycle. So if you're 26 days, but your cycle is coming regularly, completely fine. If you're 31 days and your cycle is coming regularly 31 days, completely fine. The first half of your cycle, your brain secretes something called follicle stimulating hormone, or FSH. This is the one in green here. This causes the follicles to start developing. These follicles produce estrogen, and when estrogen releases to a certain degree, that will send a signal back to the pituitary gland to release LH. This is what causes ovulation. Many follicles will develop each cycle, but it's the largest and the biggest one that the egg gets released out of at ovulation. A typical menstrual cycle, all of those other follicles will dissolve. We'll see a nice rise in progesterone after ovulation, and it is the decline in progesterone that causes a menstrual cycle. For women with PCOS, all of those follicles don't necessarily dissolve, and that's where we can start to see those fluid-filled sacs on an ultrasound. Polycystic ovarian syndrome is not named well. Not every single individual who has PCOS will have cysts on their ovaries. So it's not a defining criteria for having PCOS. Now, in individuals with PCOS, what often happens is there is an error or some disconnect between the pituitary and the ovaries. So this LH is dysregulated. It's often higher in women with PCOS. This prevents ovulation. So that's why you're seeing the changes or the irregular menstrual cycles. If you're not ovulating, that's why it can become more challenging to get pregnant. In addition, if you're not ovulating, you're not going to see this natural rise in progesterone This is what creates the calm, a little bit sleepy, zen feeling before your menstrual cycle. So if you're not experiencing the rise in progesterone, you can have significant PMS symptoms, and we do see an increased association between mental health conditions and PCOS as well, things like anxiety and depression. Here's what a quote unquote normal ovary would look like. These follicles are maturing because the brain is secreting FSH, so they're getting larger and larger. The largest one is released, so the egg is released into the fallopian tubes and it travels down to the uterus to be fertilized. If it's not fertilized, progesterone drops and you get a menstrual cycle. Because of the hormone changes in PCOS, a lot of these follicles here become arrested and they're not properly dissolving and properly developing. This is where we see some of those fluid-filled sacs on the ultrasound, but again, not everybody needs that. Here's just another diagram showing what a classical normal ovary would look like versus an ovary with PCOS. It's this string of pearls or this string of fluid-filled sacs that is what we are classifying on ultrasound. PCOS is incredibly common and it's the most common cause of infertility. Having PCOS though does not mean that you cannot get pregnant. Too many young women are told that the only option is birth control. You're going to struggle to get pregnant. Come back when you want to get pregnant. We'll take you off the pill and then we'll help you. That is not the case for everybody. There is many women who can get pregnant with PCOS when the underlying hormone changes are corrected. It does not mean that you cannot get pregnant. So I want to emphasize that because many women come to me in my office devastated, having been told in their early 20s or young teens that this is going to be an issue for them. The hormone imbalances of PCOS, they do interfere with the release of the eggs from the ovary, but there are things that we can do to rebalance the signals so that you are ovulating and can get pregnant in the future. What exactly causes PCOS is unclear. There could be a genetic component to it. We do see that. Environmental things can influence the genetics that you have as well. We do know that there's low-grade inflammation when it comes to PCOS. Most commonly, though, is this underlying insulin resistance, and that's why we're going to be focusing on this today. And what is insulin resistance? We're going to be talking about in the upcoming slides as well. What happens is when you have more insulin in your blood, this forces your ovaries to convert estrogen to testosterone. This can stop the ovulation. And the elevated testosterone is where we see the signs and symptoms of acne, oily skin, facial hair growth, hair loss on the head. The testosterone, yes, it can produce the symptoms, but often the testosterone is elevated because of the insulin resistance. So when we're looking at treating the root cause, we always want to see, is insulin resistance impacting this individual and how can we address it so that the hormone symptoms get better? How is PCOS diagnosed? It's often diagnosed by having 2 of the 3 signs and symptoms. So the first one would be irregular cycles or not ovulating. The second diagnostic criteria is signs and symptoms of elevated androgens. These are the male hormones. So if someone comes to my office and they're in their 30s and they're like, I don't know why I'm having all this acne. I didn't have it when I was on the pill. They're experiencing facial hair growth, hair loss on the head. That is enough to say, yes, you have elevated levels of androgens. So irregular periods, irregular facial hair growth, acne. The third criteria, which is, again, you only need 2 of the 3, is cysts on the ovaries. While doing a blood test and a pelvic examination on ultrasound can help confirm the diagnosis, it's not needed to get the diagnosis. Now, the signs and symptoms that each individual will experience is very broad because the degree to which the insulin resistance or the androgens can be impacting you can be greatly different. We do know that there is complications associated with PCOS. This is why simply saying to a young woman, just take birth control, everything will be fine, come back when you want to get pregnant, is not okay because we know there are complications when this is not treated. Things like high blood pressure, high cholesterol, insulin resistance can get worse, diabetes, obesity, as well as the psychological complications that we know from research do exist. So mental health, depression, there's a strong association there. So to say, take birth control, come back later when we're not at least asking the question, how is your mood around your menstrual cycle, is doing a high disservice, low self-esteem, poor body images, and reduced quality of life. Other complications that we can see, of course, those elevated androgens. We talked about the acne, hair growth, hair loss in the head, but they can also cause weight gain around the midsection. Insulin resistance. This means that you could experience increased appetite, cravings, especially sugar cravings, making it even harder for you to eat healthy, exercise, right? So we have to address the insulin piece so it becomes easier for you to manage your nutrition strategies. We can often see hormonal fluctuations, stress, mood changes. That also makes it really hard to plan, to organize, and be mindful of your food choices. While addressing weight is important, we do know that even a modest weight loss of 5 to 10% from baseline can significantly improve insulin resistance. Yes, that research exists, but again, simply telling somebody who has an underlying issue, eat less, exercise more, is not going to be helpful. It's very hard to see results with just that alone. It can become frustrating, unmotivating, as well as when you have these big fluctuations in your blood sugar, it's very hard to stick with a designated nutrition plan. It's not because of a lack of effort. It's not because of a lack of willpower. It's an underlying condition that we need to treat. Labs for PCOS, I often run the androgens. So I want to know, where is your testosterone? Where is your DHEA? I also run all of the hormones. So I want to know where your estrogen is, where your progesterone is, because again, if you're not ovulating and you're not having that rise in progesterone, you can have significant PMS symptoms that can impact your quality of life and your relationships. The other thing that we like to measure is something called sex hormone binding globulin. You can think of this as a catcher's mitt that binds on to extra hormones. So if you have a reduction in this binding protein and it can't bind on to the extra testosterone, you're going to have more free testosterone floating around, creating some of those issues. Having a little bit higher levels of testosterone is not the end of the world. It's too much of a good thing that's producing signs and symptoms that's an issue. Women with PCOS, if you have a little bit more testosterone, you'll have a better sex drive. You'll have an easier time putting on lean muscle mass. Those are all really great things. We just need to get it into a range that's optimal for you and that you're not having symptoms. We also see that an AMH sometimes is increased with individuals with PCOS. Secondary labs, we want to measure FSH and LH. If the LH-FSH is raised, the ratio, then that shows us that PCOS might be going on. So this is something, again, that FSH-LH, it's the LH that causes the ovulation. If you're not getting that nice rise and you're not ovulating, then that's where we're going to see some of those follicles remaining. DHEA can be elevated. It's another androgen or male hormone. Estrogens can be normal or they can be elevated. Progesterone's often low because that's the one that has to rise, but only after you ovulate. So if you have progesterone low, that can be impactful. And progesterone's not only for calming in your mental health, but it's also really important for sleep. So there is the option sometimes for individuals with PCOS for a bioidentical progesterone. Often that can help with sleep and mental health. And then of course, I always want to know, is insulin resistance a factor? So I'm always measuring fasting insulin. A lot of you who are my patients know that I send you for that awful sugar drink where you drink the glucose and then we measure your blood glucose and your insulin to see how you respond. That's a test that I'm really a big fan of. But we have to know if insulin resistance is present, because that is underlying that when we can address that with key nutrition, exercise, supplementation, pharmaceuticals if necessary, many individuals, their hormones get much better. You also want to rule out other conditions. So number one, you want to rule out, if you're having irregular cycles or absent cycles, rule out pregnancy if that's a possibility for you. I always run a thyroid at the minimum of TSH or a full thyroid panel because we want to make sure that thyroid's not impacted. Cortisol, your stress hormone, PCOS symptoms sometimes can mimic another condition called Cushing syndrome. Prolactin, we want to know that. Also, there is another condition called congenital adrenal hyperplasia that looks exactly like PCOS, a quick marker to rule that out. I always run that just to check the box. Because there is that increased risk of having issues with cholesterol with PCOS, I always do a cholesterol panel as well. And we're going to talk in some of those upcoming slides why it's important to also know where your vitamin status is. Things like vitamin D and iron are really important for blood sugar management. So I always like to make sure that that's not contributing. Now, it might not be the one sole cause for having issues with your blood sugar or insulin resistance, but for these individuals who are more susceptible, we don't want anything making it worse. And something as simple as a vitamin D blood work can provide us insight with the amount of vitamin D that you need. So what is this insulin resistance that I've been talking about? Carbohydrates that you eat, whether it's fruit, root vegetables, or it's cookies and pasta, they're all carbohydrates and they're all going to be broken down into glucose or sugar. That glucose or sugar enters into your bloodstream and it signals to your pancreas to produce insulin. We need insulin. Insulin is the key that opens up these cells to get the energy in. In insulin resistance, what happens is the keys are a little bit jammed. So the pancreas senses the blood sugar is not going down. It produces more keys, but making more copies of keys that don't work is not going to be helpful. So in insulin resistance, the cells are not responding to the signals of insulin. Having high levels of insulin, it's a fat storage hormone. It says we have energy available. We either need to use it or store it. If your cells can't use it, you're going to store it. In addition, it's that insulin that causes the estrogen to be more converted to testosterone in the ovaries. And then you have the signs and symptoms of the elevated testosterone. Now, what we want to look at is, one, is this occurring so we can test for it? And two, understand why your blood sugar influences your hormones. And again, this is a big spectrum. So maybe you don't have PCOS, but if you do have insulin resistance, this is why it's going to be impacting your hormones. You can see changes in your cholesterol. We talked about that binding protein in the liver, sex hormone binding globulin going down. In addition, if we go back here, if these cells cannot get energy in, your cells are interpreting this as you're cellularly starving. So you're going to have food cravings. You're going to have the ups and downs in your blood sugar. You're going to have that hangry feeling or anxiety. All of this can be triggered from dysregulations in your blood sugar. So this is why it's really important to address. Insulin resistance over time creates improper signaling to the brain. So your brain is not sending the proper signals to your ovaries to say, okay, it's time to ovulate. Okay, follicles, it's time to reduce and go away. Or, the egg's not fertilized, it's time to shed the lining. Insulin resistance can lead to a whole array of other symptoms. Diet and lifestyle for PCOS. Before we go into this, is that making sense? Do you have any questions about your menstrual cycle, how that works? Have any questions about insulin resistance? Okay, got the fingers, the good fingers. Okay, all right, if you have any questions, let me know. I can go back. All good. Baseline. Baseline would be your current weight. So if you hypothetically are 200 pounds and we're looking at how we can make a significant change in insulin resistance, it would be 5 to 10% of your current weight that you are. Okay. Many doctors recommend weight loss, and even losing 10 pounds can make significant improvements in your insulin resistance as well as your risk of diabetes. Your period, yes, this is a great question. Your period every 28 days is, we only say 28 days because it's very easy to say half is 14. The other half is the second half, but it really can vary. What's most important that it's coming the same time each month. If you're less than 21 days or less, I start to look into that. If you're having any signs and symptoms of mood changes or really bad menstrual cramps, problems that are coming cyclical, so migraines always the same time around your cycle, then that's not normal. We want to look at that and run some blood work. If your cycles are really long, so over 35 days, we want to have a look to determine what's going on there. If you've been diagnosed as pre-diabetic, chances are you will have insulin resistance. That is what precedes the diagnosis of diabetes. So if we go back to this diagram here, if the key can't open the cell to get glucose in, what will happen is your blood sugar will remain high. And remaining high over time, eventually the average blood sugar that you have, once it tips over typically 6, we say, okay, diabetes, right? But it's the insulin resistance that can precede it. And again, even a modest reduction in weight, 10 pounds, 5 pounds, can really make a big improvement on the insulin resistance, thus reducing your risk of developing prediabetes and diabetes. All right. Yes, losing weight can be helpful, very helpful. The problem is insulin resistance in itself makes it challenging to lose weight because insulin, again, it's a fat storage hormone. So if you always have high levels of insulin, you're never going to be able to tip the teeter-totter. So we have insulin, store fat, glucagon, break down fat. If your insulin's always elevated or goes way too high after you eat a meal and stays high, you're never going to have that time between your meals to break down fat for fuel. So managing the insulin piece, so you eat carbohydrates, you should have a little bit of insulin, great, it goes into the cells, amazing, blood sugar comes back down, insulin comes back down, you haven't eaten in a couple hours, glucagon comes up, break down fat for fuel. When I measure insulin, I'm often doing a morning insulin because these individuals, you should be fasted in the morning. We send you without food. So if your insulin rate in the morning is already high, every time you eat a meal, it's just going to stay up, go up and stay up. And this can be particularly discouraging for individuals where they look at, my friend can eat X, Y, and Z, there's no issues. I eat it, I retain all this water, I feel like junk, and I gain a whole bunch of weight overnight. That is classical insulin resistance, or feeling very tired after meals can be a factor as well. If we're not measuring insulin, if we're just measuring your hemoglobin A1C, or we're just measuring what your blood sugar is, you could have super high insulin and it's doing its job at keeping your blood sugar normal. So you're normal, you don't have diabetes, everything's great. But progressively over time, that blood sugar will eventually come up. So it's a missed opportunity if we're not doing enough diagnostic testing to understand when did insulin first start going up, okay? So what we want to do is we want to improve the insulin response. So you produce an appropriate amount of insulin and your cells respond so that you have the proper signals when you eat foods, right? We all know individuals who can eat as much as they want, as much carbohydrates as they want, and they don't have any consequences from it. We always want whole foods, yes, but if we can improve the signaling, then you don't have to be as restrictive with your nutrition plan. Many individuals will come and they're eating very, very low calories, they're trying very hard, they're doing all of this exercise and they're not seeing a result because that insulin piece is not being addressed. If we can address the insulin, you'll see results much quicker. And you'll be able to eat more, and you'll be able to tolerate more carbohydrates, and we'll talk about what that looks like. So here's the cycle. You eat food, you make insulin. If your cells are resistant, you're going to store fat, and again, that's going to make you tired and hungry because your cells are not getting glucose in. So you have stored energy, you have stored glucose, but if your cells aren't getting it, that's going to tell your brain, hey, I'm hungry. Appetite goes up. So again, it's not a lack of willpower, it's the fact that your cells truly are starving. We want to make sure that our blood sugar is stable. If you have really high levels of insulin, what often happens is your cells aren't responding, your blood sugar stays high, but eventually the cells respond because you're producing so much insulin, you have this crash. Once your blood sugar crashes or it goes low, your body releases cortisol, or a stress hormone, to bring it back up. Cortisol can trigger hot flashes, so that's why blood sugar is really important for perimenopause and menopausal women to not have those cortisol spikes, so hot flashes are going crazy. In addition, up to 50% of anxiety can be triggered by this ups and downs in blood sugar. So you have someone who's feeling very anxious, their cells are starving, and you're telling them to eat less. And then you're telling them to exercise more so their appetite increases more. It's a vicious cycle that's very hard to maintain. So how do you eat for insulin resistance? There's so many approaches, paleo, low carb, keto, gluten-free, dairy-free. It becomes overwhelming with information. The best nutrition plan is going to be one that's going to address your unique issues. Hopefully we've diagnosed them ahead of time before we're giving blanket recommendations. And it's one that has to be sustainable. There are some times that I will suggest restrictive nutrition plans, but I always have an endpoint for individuals. If I'm suggesting low carb and the patient is like, I love low carb, I could eat this the rest of my life, amazing, great. But if it's, well, I want to be able to go out and socialize with my friends, I want to be able to have this, then we have to have an end date. So we need to be strategic, get the insulin resistance under control, remeasure the insulin. If that insulin is now under control, we can cycle carbohydrates back in. And it often comes down to lifestyle too. So we're going to talk about some other things that have nothing to do with nutrition that can impact your blood sugar. So if you're not sleeping, if you're not managing your stress, if you're not moving, you don't have to do crazy exercise, but you need to move. If you're not willing to do those things, then we're going to have to be more strategic with the nutrition plan. But if you are willing to move, if you are willing to get good quality sleep and go to bed at a consistent time, if you're willing to look at some of the emotional thought processes that you're having, that's going to improve your cortisol. That's going to improve your blood sugar. If you're willing to utilize some key supplementation, even temporarily, to improve this response, we won't have to be so restrictive with your nutrition plan. It has to be enjoyable, sustainable, and healthy for you. We will talk more specifics for you guys as well if you're looking for a concrete plan. How does insulin resistance develop? We talked about the genetic predisposition. So there are some genes that we know have an increased association with blood sugar issues. But again, your genes are influenced by your environment. So just because you don't have the genetic predisposition to have insulin resistance or issues with blood sugar, if you eat fast foods every day, of course you can develop those issues. So it's our environment that can influence how these genes are turned on and turned off. Individuals who've done a 23andMe ancestry and health data, I can take that data and put it into another platform that would have a look at this. This would help us to understand, are you someone who would benefit more from nutrition plan X, Y, and Z? But again, it has to be something that you enjoy. If I say, I want you on a animal-based protein diet and you're vegetarian and that doesn't align with your values, that's not going to work. So an individual approach is really important. Stress. When you're stressed, your body is releasing blood sugar so that your muscles can have enough energy and your brain can be sharp so that you can run away from a bear. Our bodies don't know the difference between relationship stress, work stress, pandemic stress, kid stress, and a bear. Always going to be releasing blood sugar. If you're always releasing blood sugar, that will raise your insulin. There is evidence to support that nutrient deficiencies, and we're going to talk about what those all are, can contribute to insulin resistance. May not be the sole cause, but again, if you have this predisposition, we want to do everything that we can so that you don't have to be as restrictive with your nutrition plan. Gut bacteria imbalances, we're going to talk about. I love this research. And then of course, overconsumption of carbohydrates or poor dietary habits can contribute to insulin resistance as well. But again, emphasizing that it's not always just nutrition. It's not always a lack of willpower. It's not that these individuals, haven't tried really hard. It's a combination complex process with a genetic predisposition. Stress is not just the thoughts that you have and not just how you're perceiving your environment. It could also be chronic inflammation. So maybe you have pain. That can lead to inflammation, which increases your cortisol, which increases your blood sugar. Infections can increase stress in the body. Dehydration, lack of sleep. We have to look at everything. Ways to reduce stress. We want to move, but we don't want to over-exercise. If you are over-exercising, this is a stress in the body, it creates inflammation. That should happen with exercise. It's when you do too much of a good thing where it becomes impactful. In the metabolic reset program, I often have individuals reduce exercise. Let's give your body time to heal. Let's reduce inflammation. And individuals, sometimes they don't believe me about reducing exercise, but when we do it, they see dramatic improvements in terms of their inflammation goes down, weight goes down. You do not need to do 2 hours of exercise every single day. You do not need to do even an hour of exercise every single day. Exercise has so many benefits in terms of mental health, muscle mass, longevity, mental health, bone health, cardiovascular health, but exercise is not a way to lose weight. It comes down to nutrition, and what dictates how your body utilizes your nutrition is your hormones. You can also consider yoga, gratitude journal, the 5-minute journal. I love that. You can just buy it off of Amazon. Really easy to write down some things that you're grateful for. Meditation, massage, connect with loved ones, counseling, therapy, self-care. Do something to reduce your stress each and every day. Lack of sleep is a huge one, so I really want to emphasize this. If you're not getting good, adequate sleep, if you're not feeling refreshed in the morning, we need to look at why that is. If you're not having good sleep, that'll interfere with your hunger and satiety hormones. If you're hungry all the time, it's going to be very hard to stick to a structured nutrition plan. We also want to assess for sleep apnea or sleep disorders. If you are snoring, consider a sleep study. If you're not feeling refreshed in the morning, if you're feeling groggy, consider a sleep study, because not having good sleep impacts your weight. So really, really important to emphasize sleep. If you are not sleeping, cortisol goes up, increases your blood sugar. Insulin sensitivity reduces, higher levels of inflammation. Sleep hygiene is important. Getting outside, just 46 minutes of less sleep every night is what you can get if you are not getting sunlight. So just go outside, get exposure to sunlight each and every day. Try not to have caffeine before bed. So caffeine, if you're having it, have it in the morning. Even 6 hours before sleep is enough to interrupt your sleep. Even if you feel like, I can drink coffee and I can go to sleep. And many of my clients will say that, you know, I drink coffee, it's fine. It doesn't impact my sleep, but it does impact the quality of your sleep, even if you are sleeping. Exercise, the best time to exercise is when you're going to actually do it. But in terms of the research on sleep, it does appear that exercising in the morning results in better quality deep sleep versus exercising at night. If you are having to exercise at night, consider something like a magnesium or the Relax and Focus to lower that cortisol response. Alcohol before bed. Yes, you can get to sleep better, but it will impact your quality of sleep. Make sure your room is cold. Your natural body temperature will reduce around 9 p.m., helping you to sleep better. So your room needs to be cold. This is why exercise can also impact that. If you get your body temperature up and it's sustained up before you go to bed, you're not getting that decline and then you don't have as much deep sleep. Go to bed by 10. Try to avoid having screens, or at least dim the lights on your electronics, or consider blue light blocking glasses. Blackout blinds. They did a really interesting study where they used this like a laser pointer pen and put it behind individuals' knees, and they found that just that exposure on the skin to artificial light disrupted their sleep. So your skin has photoreceptors. Make sure your room is dark. Any little lights, or especially the blue lights, get it out of your room if you're struggling with sleep. Okay, nutrient deficiencies. This is where I really like to test to understand what is particularly impacting you. We do know that altered levels of key nutrients increases oxidative stress, and that stress can increase insulin resistance and diabetes. In the Reset program, this is why I like individuals to write down what they're eating at each meal, because we can look at where your nutrient levels are, and through diet, just dietary means, suggest some things to increase certain levels of some of these vitamins and minerals that you might be deficient in. So here's a chart. At the end of this presentation, all the research studies are linked. So if you want to dive more into what this research has specifically said, you can definitely do that. Boron is one that deficiencies can increase insulin, and boron is often used to help reduce the testosterone in individuals who are having some of those signs and symptoms. We want to make sure that your diet's high enough in calcium. Things like iodine too is really important for the thyroid gland. Iron's a huge one. I see so many individuals who have had chronic low levels of iron. This will impact your blood sugar. Low iron, just because it's common, does not mean it's normal. It's very unfortunate that as our population as a whole, our values go down and down and down. What happens is we just change the reference range. So lower levels of ferritin, a storage form of iron, used to be 50. It's all the way down to 5 now in Ontario. Same lab in another province, it's 50. So you can hop on a plane and travel, and you're deficient here, but not here. That doesn't make any sense. We want to make sure that you're in the optimal range. In addition, having low levels of iron, we're going to dive into this because it's something that I see all the time. You're not going to be able to think clearly. You're not going to have enough oxygen to your brain. Your food cravings are going to be out of control. If you're tired, what are you going to reach for? You're going to reach for high sugar, high fat foods to give you that energy. This is not a lack of willpower. This is your body craving anything to get an ounce of energy because your iron's so low. Magnesium, it's the most common mineral deficiency that I see. Our soils are depleted. We're not consuming enough fruits and vegetables. Magnesium is really important for blood sugar management, blood pressure, hormones, bone density, mood, sleep, bowel health. Magnesium is key for so many things. Selenium, really important for your thyroid too. Brazil nuts, super rich in selenium. 4 to 6 a day will give you a really great dose of selenium. And of course, zinc. Zinc, oysters, pumpkin seeds would be another great source to consider as well. I want to focus on iron a little bit because it comes up so often. Number one, we always want to manage your symptoms. If your ferritin is less than 80, you're not going to have good motivation. Your thyroid's going to become impacted. You might experience hair loss, brain fog. We have to get this up so your symptoms are improved. But we also have to look at, why is your iron low? Are you not consuming enough in your diet? Can we make some changes there? Or if you are consuming it, why isn't it being absorbed? Or if it is being absorbed, where are you losing iron from? Are your menstrual cycles really heavy? So we have to address the root cause of why it's low while also improving your symptom management. Iron's required, again, to make thyroid hormone. It's required to convert tyrosine to dopamine, your motivation hormone. And again, if you have low iron and you're struggling with resistant weight loss, but you don't have enough dopamine to be motivated to get out of bed or the energy to do so, how are you going to eat less and exercise more with this state? You have to address this too. Iron reflects the amount of oxygen that your body can carry around. So it's really important for your energy. It's important for brain fog too. It can be incredibly debilitating to have low iron and have to get through your day and function. So this is something we have to look at. I always look at ruling out celiac disease for individuals who have this low iron, because there's a reason why your iron's low. If it's not diet, if it's not heavy menstrual cycles, we need to look at why that is. Iron deficiency has been shown to impair glucose metabolism. So anyone with insulin resistance and PCOS, look at your iron to make sure it's optimal. Interestingly enough, too high levels of iron can also do the same thing. So there is a happy medium when it comes to iron. Gut health, this is one of my favorite topics in terms of insulin resistance, because we know now that our gut microbiome can influence our blood sugar, can also influence the amount of calories you absorb from the foods you eat, and inflammation. So most of our studies on this is done in rats, where they took a rat that was obese, took out its feces, transferred it into the lean rat. I don't know why, but they did it. That lean rat, they did not change its diet, did not change exercise. That lean rat then became obese. This is really powerful. If we can change the gut microbiome to reflect a better state so that insulin resistance is managed, easy. We can look at an individual's gut microbiome and have insights into what their body mass is going to be. So just by looking at stool, we can predict who would have a lean body composition or an overweight body composition, which is really, really fascinating. So we're starting to understand, we talked about that. They play a very important role, and the gut bacteria can actually predict your blood sugar levels after a meal, which is so fascinating. Now, they also looked in humans in twin studies. So these individuals are genetically identical, but we can see individuals, even twins, have dramatic differences in terms of insulin resistance and in terms of their body mass. What they're finding is there's very key differences in the gut microbiome of these two individuals. We are also beginning to understand that we can influence blood sugar management through things like pharmaceuticals such as metformin, natural option berberine. Now, interestingly enough, the research on metformin that many of you who have insulin resistance or PCOS might have heard of or might have been recommended, metformin, some of the impacts or some of the benefits that we're seeing in terms of the insulin resistance, we are now noticing that this drug or pharmaceutical actually influences the gut microbiome. And that's in part why these symptoms are improving. Metformin and berberine, they both have been shown to increase something called AKKERMANSIA. So when I'm doing a GI map stool test on an individual, I'm always paying attention to AKKERMANSIA. It's a certain type of bacteria that we want to have an abundance of for weight management. When AKKERMANSIA is low, we see more insulin resistance, more inflammation, more obesity. And here's the public research that you can have a look at. Ways to boost AKKERMANSIA: number one, intermittent fasting. Number two, reducing fats in your diet. Not everybody benefits from a high fat diet. For some individuals, we need to lower fats. It's not to say no fats, but lowering, as well as looking at the quality of the fats that you're consuming. There is a big difference between fats from avocado, fats from nuts and seeds, and fats from canola oil. So we really want to look at healthy fats versus inflammatory fats. And we're going to talk about what those are and how your cooking can actually influence the quality of the fats that you're consuming. Prebiotics like glucomannan. So in my reset program, we're using glucomannan. It's a specific type of fiber to increase AKKERMANSIA. So we're using all of these underlying additional strategies. Yes, food's important, but we need to influence the gut microbiome and influence your insulin in order to see the results. Berries, so polyphenols have been shown to increase AKKERMANSIA, so I love fruit. I recommend fruit at every single meal, especially berries. So blueberries, raspberries, anything like that is great. Curcumin, an anti-inflammatory, can boost AKKERMANSIA. We know when individuals are chronically inflamed, AKKERMANSIA goes down. And of course, berberine. Berberine's one of my favorites that we'll chat about. On the GI map, what specifically I'm looking at is called the FB ratio, or Firmicutes Bacteroides ratio. This is just reported on the GI map. When this is elevated, that's what's been shown to increase calories being extracted from the foods you eat, more fat deposition, so more weight gain, more impaired insulin sensitivity, and increased inflammation. So this is something you can actually measure. Nutrition. So the American Society of Reproductive Health suggests healthy behaviors, including healthy eating, regular physical activity. They're recommending this to achieve or maintain a healthy weight, general health, improved hormone outcomes, as well as quality of life. So we talked about the quality of fats, and we talked about particularly how you are cooking your fats. When you heat oils, what happens is we produce something called advanced glycolic end products, or AGEs. If you heat oils at high temperatures, what research is showing that it actually increases your risk of insulin resistance and inflammation. So a very simple strategy that you can use is, instead of cooking with oils, cook with broths or cook with water. Oils are not bad, healthy fats are not bad, but add them after. I would recommend primarily consuming oils from fatty fish. You can get healthy fats from avocado and nuts and seeds. Always choose whole foods fats over these cold pressed oils, overheating with these oils. So I always get the question, what about eggs? So if you want to have, and again, it's all about overall. So if we can reduce your cooking with oils, 60, 70%, amazing. If you have to use it sometimes because things are going to stick, fine, it's not the end of the world. But what this research was showing is, if fruit gets this bad rap, oh, we can't have fruits, too high carbohydrates, insulin resistance. It was actually not the fruit, it was the diet high in AGEs that was creating the issues for individuals. So fruit, again, all polyphenols, great for your AKKERMANSIA, great for your gut health, healthy fibers, because the more fibers and different prebiotics we have, the better gut health. Just reduce the amount that you're cooking with your oils. It's very easy once you get into the habit of doing that. I do waters and broths and tons of different herbs that taste the exact same. How to reduce AGs, we talked about avoid cooking with oils. Processed and packaged foods are loaded with them. Cook with broths or water. Eat more fruits and vegetables. These have antioxidants to mitigate some of the impacts of AGEs. And if you're barbecuing and you have to have some oils to marinate for the barbecue, add something acidic to it. So like wine or vinegar or lemon juice. Eat real foods. Single ingredient foods are first and foremost. So I'm not a big fan of packaged foods and shakes and different meal replacements. Just eat whole foods, single ingredient foods. If it comes from the farm, not a factory, if it has one single ingredient, apple, cucumber, go for it. Typically, those are the outsides of your grocery store when you're shopping. I do recommend minimizing grains and dairy. Not everybody is sensitive to dairy. Not everybody's lactose intolerant. Not everybody is sensitive to grains. Not everybody has to be gluten-free. But if you can minimize them and reduce them temporarily, 4 to 6 weeks, fully get them out, then add them back in one by one. That's the best way to understand if this unique food is impacting you. So gluten-free, 4 to 6 weeks, add it back in, 3 servings of gluten for 3 days. If you feel great, amazing. There's no issues there for you, unless of course you've been diagnosed with celiac. Do the same with dairy. The problem with dairy is the proteins in it can raise insulin further. So that's why we recommend the dairy-free. There is an association that I see clinically all the time, individuals struggling with acne and dairy. For some individuals, they can tolerate sheep or goat or buffalo mozzarella better. But again, if you can try 4 to 6 weeks, then add it back in and see how you do. Then you're equipped with the tools and knowledge to understand if that's a food that's inflammatory for you or not. Eat vegetables. Half your plate needs to be vegetables. Eat more fruit. I like a serving of fruit at each meal. Include protein at every single meal. Protein's really important to build lean muscle mass. In terms of insulin resistance, if that key can't fit the lock, there is a back door that sugar can get in, that glucose can get into your cell. And what opens that back door is resistance training, or at least moving your muscles. So if you can have more muscle mass, your body will be better able to be equipped to respond appropriately to insulin. I'm a big fan of animal-based proteins. Really looking at the quality of your meats is going to be important. So grass-fed, grass-finished is often better if you can get access to those types of meats. Cruciferous vegetables, broccoli, kale, cauliflower, bok choy, Brussels sprouts, all of these ones are really important because what we're seeing is that the particular component of these cruciferous vegetables, sulforaphane, actually reduced weight gain 15% lower. This was a rat study, yes, but I do see this clinically all the time that sulforaphane is really, really important. So looking at, can you have a serving broccoli, kale, cauliflower, bok choy at least once a day? It's also been shown that these wide variety of different vegetables improves the diversity of your gut health. You cannot eat the exact same meals every single day. You need to diversify, try things new. Having a wide, diverse diet with tons of different fruits and vegetables is how you're going to get a wide, diverse gut microbiome. Protein is number one. Size of your palm is about 30 grams. So if you can do this 2 to 3 times a day of protein, that would be really helpful. Protein will help to keep your blood sugar stable, so will healthy fats. But again, don't cook high heat with your fats. Omega-3s in fatty fish are amazing at reducing inflammation. High fiber, 25 to 30 grams. If you're like, what the heck, how do I measure that? MyFitnessPal is a free app. You can just download it on your phone. Perhaps just out of curiosity, 2 to 3 days, just track and see where you are. Are you getting enough fiber? Are you getting enough protein? So many people argue over carbs or fats, which one's better, which one should I not have? Focus on protein first. Get your protein in and then see where your fats and carbohydrates lie. Oftentimes we overconsume carbohydrates, we overconsume fats because we don't have enough protein. Now for individuals with insulin resistance, we want to be mindful of the amount of carbohydrates. Carbohydrates is converted to the sugars, which raises your insulin. The amount of carbohydrates that you will have will determine your insulin response. This is where testing is really appropriate, and understanding the individual is important too. If I told patient A 50 grams of net carbs and patient B 50 grams of net carbs, one will be able to do it. They'll think that's great because they enjoy low carb foods. For another individual, it won't be sustainable. So we have to look at what foods do you enjoy and where can we reduce things, where can we swap things out, how bad is this insulin piece. That will dictate when we can add carbohydrates back in. So initially, maybe you are doing a lower carb approach, but if it feels daunting to think that you have to do this forever, you need to know how is your body responding. So when can you cycle those carbohydrates back in? And again, when it comes to sugars, it doesn't matter if it's maple syrup, honey, coconut, or white sugar. It's all interpreted by the body as glucose. So if you're looking for natural sweeteners that aren't going to impact your blood sugar, are not going to impact your insulin, choose things like stevia or monk fruit will be better options. In terms of a nutrition plan, this is something that I often use and I put together for you guys. It is a lower carbohydrate nutrition plan. I will send this out to you for you guys to have a look at, to get some ideas for recipes. If it's helpful to follow it exactly, great. If you just want to check out some of the recipes, do that as well. You will get the link to download this tomorrow when the recording is sent out as well. The other aspect that I often suggest for individuals with hormone imbalances is seed cycling. So what this is just an intentional variation of certain seeds that have been shown to have really great anti-inflammatory oils within them, like omega-3s. And what this also will do is this extra fiber will help bind onto the extra hormones that your body's producing. Fiber is really important for your gut health. So this can be something that's really easy for you to add in. Now, traditional seed cycling, the way it's done is the first half of your menstrual cycle, you add 2 types of seeds. The second half of your menstrual cycle, you add 2 different seeds. I often recommend get the seeds, blend them up, put them in a container, put them in the freezer, labeled day 1 to day 14, 14 to 28. If you have an irregular cycle, or if you're like, that's too confusing, I'm just not going to do it, it's not an exact science, dump them all in to 1 container and add 2 tablespoons each day to a smoothie. You can add it to water or an oat milk, and you toss that back if you can stand the texture. I personally add it. You can add it to salads, you can add it to soups, anything like that. So here's the exact details. If you want to check this out, this is very food-based. It sounds very simple, but it often produces really great results for individuals. It's all whole food based. This extra fiber can also be helpful for individuals who are struggling with constipation. You'll get the link to check this out after the presentation too. In terms of a tool that you can use to see where your blood sugar is, to see if you're having variations, this is the Freestyle Libre Continuous Blood Glucose Monitor. This will not tell you about your insulin. It'll only tell you about your blood sugar. So if your blood sugar is fine and dandy, you can still have that insulin that's high and it's keeping it under control. But this is a tool that you can have a look at to understand how certain foods are impacting your blood sugar. So you simply stick it on. It's a little tiny, small, minuscule little needle. It's in your arm. You're not going to feel it. And you scan it with your phone. So what you do is you consume a meal and you measure your sugars an hour and 2 hours after to understand how your body responded to that meal. If your blood sugar goes above where we want to see it, then we would look back at that meal and say, okay, that was too high in carbohydrates for you. In terms of how I have patients track this, you're also going to get this, so you can track it on your own too if you're interested, but you put the date, you measure your blood sugar before a meal, then you measure it an hour and 2 hours after, and you write down specifically what you ate in terms of carbohydrates. This provides some really great individual feedback for you. For whatever reason, my blood sugar really spikes with sweet potatoes. Technically, it shouldn't because there's enough fiber in those sweet potatoes, but for me, it does. Now, do I avoid sweet potatoes altogether? No, I'll still consume them, but I look at how I felt after that meal. If I'm really tired or really groggy, then that's even more feedback to me to say, for whatever reason, we want to keep those out. Has anybody ever used the continuous glucose monitor? You can put a 1 in the comment if you have. I'd be interested to see that. You can just order that online as well. Now, meal timing matters. Oh, lots of ones. Cool. Many of you know that I'm a big fan of intermittent fasting. When you're not eating, your insulin comes down. For people with insulin resistance, it doesn't come down enough, but intermittent fasting can help it come down even more. In your muscle cells, we have increased insulin sensitivity, reduced inflammation. Liver, we're seeing the same things. We see increased ketone productions. Ketones are a product of fatty acids being broken down, so you have better mental clarity. The amount of intermittent fasting will depend on the individual and depends on if it fits your lifestyle and if it's something that you enjoy. Typically, I recommend consuming all of your foods within an 8-hour window. And if you have insulin resistance, try to cut out the snacking. Have your meals, but allow enough time in between for that insulin to come down. In the brain, we're seeing reduced stress, we're seeing reduced inflammations, kidneys, intestines, decreased inflammation as well. Here's a study that looked at insulin is lowered when you're doing intermittent fasting. We're also seeing an increase in your metabolism for 24 hours after. And one of the questions I often get is, if I'm fasting, isn't my muscle going to be broken down? If I skip a meal, isn't my muscle mass going to go down? It will only go down in individuals who don't have weight to lose. So if you are approaching your ideal body weight or have a lot of lean muscle mass and low fat, you want to be extra careful with intermittent fasting, supplementing with more amino acids, supplementing with more protein. But it appears that individuals who are overweight or obese, their bodies are going to tap into their adipose or fat tissue first. What breaks a fast is anything that has calories in it, in my opinion. So I am very much black coffee, green tea, water, lemon water is fine. save your foods for when you're in your feeding window. And there's so many great apps that you can utilize to time your fast. If you want to start with the 16-8 and see how that goes, great. If you want to just fast during the week and not on the weekend, great. Try it out and see what works for you. Exercise. Now, this becomes really tricky. Exercise has been shown to be impactful for weight management. It's been shown to be impactful for lean muscle mass, bone health, mental health. So many reasons to do exercise, but it is not a tool and strategy that we should be using for weight loss. In terms of weight loss, it's the nutrition and it's how your body is interpreting the nutrition in terms of its hormones that will create the biggest impact. Short, high-intensity interval training, short resistance training, exercise that you actually enjoy, that makes you feel good, are ones that I would recommend. I would recommend avoiding long-form cardio. Going for a 10-minute walk after meals, amazing. But don't feel you need to sacrifice sleep to get an hour of cardio in, plus your resistance training that's creating a lot of stress and a lot of inflammation. Exercise, moving your muscles is fantastic for opening that back door to get insulin in, but you don't have to do crazy exercise. And I would recommend scaling it back initially to get your hormones and nutrition dialed in before adding in exercise, before adding in resistance training. So now we're going to go into supplements for PCOS and what the research says. Supplements are they're not a weight loss supplement. That's not what we're doing here. We're addressing the underlying insulin resistance to see better improvements in your hormone, easier to manage weight, your appetite is better, you can eat more and move less and still maintain the same weight. We also consider supplements in PCOS patients who are looking to get pregnant, looking to increase the amount of time that they're ovulating every year, right? If you can ovulate each month, that's more chances of getting pregnant, increased egg quality. We want to look at what specific nutrients are missing in your diet and add those in, or if you're not absorbing well, how can we supplement that until we fix the absorption issues? And we want to optimize nutrient levels. Things to consider: supplements, you will not out-supplement a bad lifestyle. You will not out-supplement, not looking at your stress or not sleeping or not consuming whole foods. They're not weight loss pills, but they can be helpful in combination with healthy lifestyle. You want to discuss your dosaging with the healthcare provider to make sure it's safe for you. I will be discussing ranges of dosaging. Again, this is not a specific dose for you. This is not, as we go through them, you don't have to be on every single one of this. Some are better for others, depending on what we're seeing on labs. So this is, again, just education to consider and things that you can do additional research on. You also want to make sure that you're on a really high quality supplement. In Canada and the US, there's not really strict regulations in terms of quality testing. So perhaps some companies are doing quality testing initially, and there's not really much responsibility on the company to do follow-up testing unless there is an issue. So make sure you are taking good supplements. Metformin, this is the main diabetic drug that we're using to manage insulin resistance. And I hope now that you understand why we're using it for patients with PCOS. It's been shown to help lower blood glucose level. It's been shown to help improve appetite. The one main issue with metformin that we often see is GI side effects. So if you are experiencing some gut health issues with taking metformin, we'll talk about some other options, but this is why we're using metformin for PCOS, to address the insulin piece so that your ovaries aren't producing as much testosterone, and then the testosterone symptoms are getting better. In addition, if we manage the insulin resistance and your hormones are better, then you'll start ovulating on your own. So this is often used for individuals who are looking to get pregnant as well. May improve ovulatory function, meaning that you'll ovulate on your own, so you get that nice rise in progesterone. May improve insulin resistance, blood sugar levels. And again, the research on metformin that we talked about is, yes, it has these impacts, but it also does appear to influence the gut microbiome in a favorable way, which is really fascinating. In addition to the GI symptoms that sometimes we see with metformin, we do know that metformin is known to deplete B12 and folate, so you might want to consider supplementing if you are taking metformin. There's a website here, mytabin.com. It's a great website. You can enter in any medication that you're taking to figure out if there is a known nutrient depletion. If there's something that you need to be on, perhaps you can mitigate some of the side effects by just replacing these nutrients. B12 is another one that I see all across North America. There is different ranges in terms of what's normal. I like to see B12 greater than 500. Again, as the population gets, I don't want to say sicker and sicker, but that's the reality of it, is it's more common and normal to just be low in B12 and low in iron and low in testosterone, especially for men. We just lower the reference range so more people fit in, but that doesn't mean that it's optimal levels. The duration of time that you're on metformin will increase the likelihood of having B12 deficiency. So any individual who is on metformin long-term, we do recommend looking at B12 levels, or at least considering looking at them. Higher levels of metformin, more likely as well, so it's the level and the dose as well as the duration that can increase the risk of low B12, and low B12 can cause some neuropathy symptoms, so tingling in the fingers, and lower energy too. So we definitely want to have a look at that. Fatigue, tingling hands, feet, mood changes, nerve damage. We always want to look at, if you're on metformin, consider supplementing with B12 and folate, or at least test your levels to see if it's needed. If you are on metformin and you have any of these signs and symptoms, please get your B12 checked and supplement if necessary. Sublingual is best absorbed. This is under your tongue. The next one that I really like to look at is something called N-acetylcysteine. This is an amino acid and an antioxidant. It is great in terms of the research for infertility. It's been shown to lower those androgens, lower inflammation, can help with cholesterol and fatty liver, reduces oxidative stress, also is a great antioxidant for the lungs. We often use this in allergies too, to thin out the mucus layers to reduce allergy symptoms as well as reduce sinus infections. And there is some research on N-acetylcysteine for lowering thyroid antibodies as well. Here's what the research has to say on NAC. NAC improved BMI, so body mass index in PCOS patients, total testosterone, insulin, lipid levels, significant improvement in pregnancy and ovulation rates compared to placebo. Similar benefits to metformin in improving pregnancy rates, spontaneous ovulations, menstrual regularity, insulin resistance, and cholesterol. Oftentimes, it's not the only thing that I'm using. It's not going to be used in replacement of key dietary and lifestyle factors, but you could consider utilizing it, especially if you have thyroid antibodies or you're looking to get pregnant. Vitamin D is so important. I run vitamin D on every single individual that I can, because it's not just important for your bones, it's important for your immune system, your mental health, your hormones, infertility, like egg quality. Vitamin D is just so important. And for individuals who live in areas where we're not getting much sunlight, again, just because everybody might be low doesn't mean that it's okay for everybody to be low. So if we need to supplement, let's supplement. If you can get outside in sun exposure, 10 to 15 minutes, you don't have to get burned. It could just be early morning, low UV index sun. That has been shown to improve your vitamin D levels. Now, not every individual will have great vitamin D just because they're in the sun. So this is where testing becomes important. So again, test to know what your dose is. You can test before winter, you can test in the summer, just to make sure that your levels are good and to know what dose you need to be on. Omega-3s, these are fish oils, anti-inflammatory oils, can improve mental health, triglyceride levels, cholesterol marker, cognition, non-alcoholic fatty liver, cardiovascular disease, skin and hair, reduces inflammation. And remember, at the start of the presentation, we talked about how PCOS has that underlying inflammatory component as well. If you eat fatty foods, great, fatty fish. If you don't, then you might want to consider a fish oil. Myoinositol and dechironiositol, these are fantastic for individuals who have PCOS and are not ovulating, as well as individuals who have insulin resistance. This is what I'm often using in PCOS patients. Improves ovulation, egg quality. If you're ovulating, then you'll have a menstrual cycle more often, can reduce gestational diabetes, and there's not necessarily randomized clinical large control trials showing that it prevents food cravings, but I do find by ovulating and keeping your blood sugar nice and stable that food cravings often go away. In terms of the research, it does appear that a ratio of 40:1 of myo-inositol and D-chiroinositol shows to be where we want individuals to be. Here's berberine. This is one of my favorite ones. Berberine doesn't have safety studies in pregnancy though. So for individuals who are pregnant, it's not going to be appropriate. For individuals looking to get pregnant, you want to work with a practitioner to understand when you're going to remove it. Berberine is antimicrobial, so it has those beneficial impacts on the gut, but long-term, we may not want to use an antimicrobial long-term. So depending on the individual, often I'm using berberine higher doses, shorter periods of time, get the insulin under control, and then we can remove it. Improves insulin sensitivity. There is comparative studies on both the inositol and berberine in comparison to metformin. So perhaps if metformin is not working for you, you can speak to your practitioner of would it be appropriate at this point in time to add berberine with it or try it instead. There's fantastic research available on berberine. Side benefits of cholesterol, fatty liver may assist in reductions in body weight, but again, this is not a weight loss pill of any sort. It's just getting to the root cause issue. Individuals who are more prone to insulin sensitivity, when we're cycling carbs back in, I will strategically use berberine at those higher carb meals. Again, it's not, you can have sugars and processed foods and just take berberine. That's not the way it's going to work. But once your insulin's under control, you can get away with using it a little bit like that. Magnesium, we talked about, really important. It's so commonly deficient. Managing your sugars, your insulin, your blood pressure, anxiety, stress, migraines, muscle tension. Individuals, when they're using magnesium, the most common issue that I see is they're not necessarily dosing high enough, so 300 to 600 milligrams. Magnesium bisglycinate is better absorbed than citrate. Most individuals, if you take 600 milligrams of magnesium citrate, it won't be absorbed and you will get diarrhea. So always look for something that's better absorbed, magnesium bisglycinate. If you're constipated, magnesium citrate might be beneficial for you. But if not, then stick with the bisglycinate. CoQ10, this is one that I'll often use in PCOS patients who are looking to get pregnant because of the positive qualities that it has on egg quality, ovulation. CoQ10 is also great for energy production and migraines, may help with cholesterol and insulin levels as well. Resveratrol, so we talked about that oxidative stress component to PCOS. Resveratrol can be a great antioxidant, also been shown to increase AKKERMANSIA, so it's one that you can consider using in PCOS as well. We see that resveratrol, there was a 23% reduction in total testosterone and a reduction in DHEA. So if you have more of those androgen symptoms, acne, facial hair, hair loss on the head, or you know that your androgens are higher on blood work, you might want to consider resveratrol. Zinc is another one that's amazing for these higher androgen symptoms. It's been shown to be an aromatase inhibitor. So what this means is you have testosterone, then it's converted to super testosterone called DHT. Zinc can help block that conversion. And if that conversion is blocked, then you'll have less of the androgen symptoms, acne, facial hair growth, hair loss on the head. May also improve PMS symptoms, acne, boils, so really great research on zinc. You can also, you don't have to take all these supplements, but look at, are you getting enough zinc-rich foods in your diet? If not, then you can consider adding some additional zinc in. Other things to consider, saw pimento, great for elevated androgens, similar mechanism as zinc. Cinnamon, chromium, ALA, all great for blood sugar. Melatonin, egg quality. Many individuals actually messaged me before the presentation asking about DIM. This is a component in those cruciferous vegetables that I really want you to have at least a serving each day. DIM can help with better estrogen metabolism. So go with the cruciferous vegetables. If you're working with a practitioner that says, hey, you've got some issues with estrogen, then you can consider DIM. Vitex, chaste tree. This is great for helping with ovulation, great for increasing progesterone for individuals who have that issue. But again, testing your levels can really streamline the process for you. Let's Get Checked, yourlabwork.com. Those are two lab companies that you can get blood work done with. You can speak to your family practitioner. You can speak to an integrative or functional medicine practitioner if your primary care isn't willing to run it. But by knowing what your levels are, it's really streamlines things to know exactly what we need to treat for you. In terms of case studies, this is a MRP or metabolic reset program patient, and I really wanted to highlight this individual because typically what happens, primary care is your doctor, they might have ran something called a hemoglobin A1C. This tells us how you've been managing your blood sugar over 3 months' time. This individual got the green check mark. You are great. There is no issues with diabetes, and that is true if you only look at hemoglobin A1C. Her hemoglobin A1C was 5.3, so not at risk. Fantastic. But when I ran that fasting insulin, it was at 203. Fasting insulin, you're fasted, you haven't ate, it should be around 40. So for this individual, insulin resistance was absolutely present, and she was struggling with resistant weight loss. So all we needed to do was address the insulin piece, and weight loss becomes easy to manage. We did the metabolic reset program for her. First round, she lost 20 pounds in 6 weeks. She maintained, she did a second round, and we ran the labs after. So this time we actually ran the 2-hour oral glucose test, which we measure insulin when you're fasting, give you a delicious sugar drink, and then measure your insulin and blood sugar after. So her insulin fasting has come down, but it still is not in the optimal range. So we need to understand that 20 pounds, amazing, 6 weeks, fantastic, but it's going to take time for this to correct. So we want to say, yes, it's come down, that's amazing, but we're not done yet. In addition, look at the insulin at the 2-hour mark. It's still going up. Your insulin at 2 hours should come back down to 250. And it's still going up well over 1,000. So for this individual, we really need to continue to focus on the insulin piece so that her results can be maintained. Remember, insulin will create really big swings in your blood sugar, so you'll have food cravings. Your cells will be starving, so you need to have more sugars and reach for that coffee, and then your cortisol goes up. So for individuals who have lost weight, if insulin resistance is still present, we still really need to help these individuals with it so that weight does not return. So you're more likely to gain weight if you have high levels of inflammation and insulin resistance because it's so hard to manage your appetite. But we can do things to improve, okay? The other thing is look at the glucose. Glucose 9.4 at 1 hour, that's way too high. So if we looked at her average was great. But her average is only great because she's having really high highs and really low lows. That's not great at all. Here's another case study. In this individual, we were focusing on thyroid health. TSH, if you've watched the previous thyroid presentation, you can message me if you missed it. TSH should be less than 2. So this individual went from 4 to 1.5. We saw increased T3. Wait a second. Sorry, guys, I'm not measuring this right. All right, we saw a reduction in the TSH to 2.99. The goal is less than 2 or less than 1.5 for optimal. So we still have some ways to go with thyroid. Hemoglobin A1C went from 5.6, so this is your average of 3 months. So this individual was at risk of diabetes, down to 5.4, no longer at risk. We also saw reductions in triglycerides. Look at how big of an improvement this is in their cholesterol panel. And we also saw that HDL, their good cholesterol, went up. So this was only a couple months in between. And this is nothing fancy. This is key lifestyle, stress management, optimizing your nutrients, and strategically measuring your blood work so that we know, are we making a difference? You can't feel, oh, my cholesterol is so good today. So we really need to have these before and after measurements so that you can have the positive reassurance that things are moving in the right direction. Here's another case. This is an individual who had low levels of iron. So again, iron's really big in terms of insulin and in terms of blood sugar. So her iron went up. We didn't remeasure her B12 because that was fine. We saw improvements in her cholesterol panel. Her fasting insulin went from 77 to 21. So that's great. But for this individual, I would say we don't need to fast as long. We can add more carbohydrates in. We don't want insulin too low. We do want it within a healthy range, but for this individual, yes, go ahead, eat carbohydrates, let's cycle them in, completely fine. You don't need to fast as long either. HSCRP, this is a marker of inflammation. So in 6 weeks' time, we saw an increased levels of inflammation, which can cause increased risk of cardiovascular disease, go into, well, the healthy normal range. So just giving you an idea of how impactful nutrition can be. There is, again, nothing fancy. It's all getting your body into an optimal state, and then you can see really big changes like this. Diet, lifestyle, nutrition, stress management, good sleep, key supplementation if necessary. All right, that's the end of the presentation. If you guys have questions, feel free to post them in the link below. If you guys are interested in connecting with me, BreanneKallonen.com is my website. I do offer virtual telemedicine consultations. We do offer the Metabolic Reset program. I'm biased, of course, but it is such an amazing program to get a strong foundation so that you can correct so many of these underlying conditions with food and key supplementation. Where do you get the sensors for the Freestyle Libre? Bayshore, so Google Freestyle Libre Bayshore. Pharmacies will sell them too. If you have a smartphone, you don't need the reader. Your smartphone can scan it now. 2 weeks, each sensor is around $9,700. You put it on the back of your arm and you can scan for 2 weeks. Just make sure if you take, like I find if I'm taking your sweater off, it can pull it out, so you want to watch with that. Optimal ferritin, 50 to 70 for a menstruating woman. If you're experiencing hair loss, then I like to see it over 80. And there we go. Costco sells the Libre, whatever it's called. It's great. Thanks, Caitlin. I'm glad you enjoyed it. Individual asked a question. I've had bariatric surgery and can no longer tolerate plain water or fruit-infused water without nausea. Watered down Crystal Light impact fasting. Okay, Crystal Light, as long as it doesn't have any calories in it, it's not going to impact fasting. Keep in mind though, sucralose and artificial sweeteners can damage your gut microbiome. So no, they're not going to raise your blood sugar. Some of them can actually raise insulin, and if you're damaging your gut microbiome and not having enough diversity, that can be impactful for your blood sugar like we chatted about. Good. I'm glad you guys enjoyed it. Broth has been a game changer. What does the citrus do when you're cooking oils? So the citrus appears to reduce the amount of AGEs that are produced when you are cooking the meats on the barbecue. So wine, citrus, balsamic vinegar I add on mine, apple cider vinegar I add on the meats too to reduce that. Almond milk during fasting, almond milk will break your fast. So anything with carbohydrates, proteins will break your fast. Technically, things that are 100% fats will not break your fast, but I just say water, black coffee, green tea, lemon water is fine. Bubbly sodas or flavored waters of that sorts are fine, just to make it easy and give your digestive system a break too. I will be sending the recording tomorrow to rewatch. There'll be a link to check out that meal plan or just check out the recipes. There will be a link to the seed cycling guide, and anything else that you need or questions that you have, my email will be there so you can reach out. Matcha is great. Will it break your fast? It depends if there's any calories in it. So are you adding any sugars to it? 5 calories per serving. Yeah, essentially it will break your fast technically, but we have to look at for how long, probably minimal. Will it impact you? Probably not. Many individuals, I'll have them consume the Relax and Focus or consume amino acids during their fast. Will that break your fast temporarily? Yes, but we have to look at why are we fasting. If we're fasting for the benefits of insulin, that temporary little bit probably is not going to be the end of the world. So it has to be something that you enjoy, right? If it's making you enjoy it better, then yeah, go ahead and utilize it. Protein powder recommendations. Whey is absolutely the most delicious protein powder, in my opinion, is whey. Pea protein powders and vegetarian protein powders, personally, I don't like them. So what I use is a collagen-based powder. The Pure Paleo Protein is one of my favorites. It's gluten-free, it's dairy-free, it's 70 to 80% collagen, which is great for your hair, skin, and nails. And the only downfall with that one is you do have to blend it. So you can't use a shaker cup and shake it. I don't find, so I use a blender with it. I mix it with coffee, hot coffee to make a latte, cold coffee and ice to make like an ice cap, or I cook with it. So the Pure Paleo Protein by Designs for Health is fantastic. Aminoline can replace protein to a degree, right? You can't just live off of amino acids. You can't just live off of collagen for your protein intake. What you want to do is use it as a supplement. So if you are having a pinch where you can't consume protein at that meal, then yes, I add a scoop of aminoline for sure to replace that. It can also, so amino acids, if you guys are wondering, is the breakdown products of protein. So they're really easy to absorb and they can count towards your protein intake. I would say the aminoline, I typically 10 grams of protein, but you can't just have scoops and scoops of that. I think you can't have protein. It's a supplement. If hemoglobin is high, is there other risk factors for diabetes? So are you meaning hemoglobin A1C? If it's hemoglobin A1C, yes, that can increase your risk of diabetes. So 5.5 shows increased risk. So 5.8, you're just in that increased risk, but there are so many things that we can do to help lower that, right? So manage your stress, sleep better, look at insulin resistance and how we can manage that. Is there key nutritional strategies we can use? If your nutrition's great and your blood sugar is still going up and you're managing your stress and you're sleeping well, then what we look at is gut microbiome, right? Because we talked about how that can relate, and potentially using something like berberine or metformin, right? We could go through the benefits and risks of all of those. Those are two of the ones that I typically start with, or there is a multivitamin that contains chromium and ALA, your B vitamins to help with blood sugar management as well, that we can consider. Hemoglobin A1C was in the 4s. Yeah, so again, hemoglobin A1C is your average blood sugar. So from that case we talked about previously, that individual was having really high highs and really low lows. Hemoglobin A1C was normal. So they were told, oh, you're normal, you're great, come back in a year. Maybe not even a year. But when we looked at what exactly was happening by giving them sugar and measuring their blood sugar, we realized that, oh my gosh, there's huge swings here. And those huge swings will cause anxiety, sugar cravings, feeling hot, hangriness. So it's really important to consider that. Metformin can deplete B12. Yeah, so we talked about how metformin can deplete B12 and folate. If you're already at risk of having vitamin deficiencies, you want to look at, can you supplement to mitigate that impact? Can you at least measure your B12 while you're on it? Metformin, berberine, any of these supplements are not going to be a magic replacement for a healthy foundation, but they can definitely be helpful for insulin resistance. Some people do metformin, they feel amazing, that helps them to get momentum, they change their whole entire lifestyle and things are amazing, and then they come off of it. Great. For individuals who perhaps don't want metformin or they have side effects with it, there are other options that we can utilize that we chatted about. So if you are at risk for lower levels of B12, either consider supplementing and monitoring to make sure that you're good. And with B12, I always recommend methylcobalamin. That's the active form of B12 under your tongue as a sublingual. I would just look at benefits and risks and decide which one's going to be right for you, but B12 is fairly easy to supplement with. If I missed your question, please post it again because I'm having a hard time scrolling up. Sugar. So feeling like you, yes, one of the questions was sugar cravings are very normal for individuals who have insulin resistance, because remember, the sugar can't get into the cell. So your cells are like, oh, I'm hungry, and can't tap into the energy that's stored as body fat. So we just need to train the body, respond in a favorable way. And hey, you've got lots of energy, you've got lots of sugar stored. We need to teach the body to tap into the storage. And there's lots of things that we do. Intermittent fasting, we talked about some of those key nutrition strategies, more protein, less carbohydrates, don't cook with your oils, and also make sure to rule out the other conditions. So have a look at how is your thyroid? How is your stress response? Where is your cortisol? When you add supplements, how long do you begin to see impacts in your clients? 6 weeks is when I typically repeat blood work. So in terms of seeing a shift in the hemoglobin A1C, that's the average of 3 months. So if you test that at 6 weeks, you're not going to see the full impact. But because I'm offering structured, strategic nutrition strategies and weight loss in 6 weeks, I like to be very structured, lose weight 6 weeks, then maintain it for 4 weeks. So I typically run the blood work before and after the program, 6 weeks to 10 weeks, just so clients can see the changes, because it's really impactful to be like, oh my gosh, look at these major changes that you've made. So as long as there's a combined holistic approach, you would definitely see big changes within 6 to 10 weeks. You can test in 3 months' time. There's absolutely no harm in doing that. Probably better to see the average over 3 months, but I find that having the before and after is so motivating that it keeps that motivation to want to continue to do more, because so much of managing lifestyle is keeping you motivated and accountable and inspired. Liver levels were high at less physical, so you want to talk to your doctor about some of the reasons for that. Perhaps it could be fatty liver if you don't have any other concerns with things like hepatitis. So look at how high are those liver enzymes, what could be causing that. I would speak to your doctor to determine, because they know you best. They would know why that is and what you can do for it. In terms of just general liver support, berberine has some good research on it. Annatto, so delta tocotrienols, has some great research on it. That's a certain form of vitamin E for fatty liver. My endocrinologist, yes. So those particular medications can be really helpful for insulin resistance. You want to always look at side effects. So if you're experiencing side effects, you want to reduce the dose and just gradually increase. Some of the side effects that we can see is nausea is the biggest one. So really working appropriately to just increase your dose as needed. Now, you want to consider, you have to change your lifestyle. So yes, these medications, yes, these supplements have been shown to be impactful and they've shown to make improvements, but not in the absence of changing your nutrition. So all of these can be very, very helpful, but you have to change your lifestyle, because eventually you're going to want to come off of those medications. So if these medications are reducing your appetite and then you come off of them, what tools and strategies do you have in play to manage that? What tools and strategies have you looked at to address the mindset piece? So every week we talk with individuals to say, what's going on with you today? What are the thoughts and the emotions that come up before that food craving? So much of this is mindset, mental health. How are you perceiving your environment? What is your relationship with food? What is your relationship with your loved ones? What is your relationship with yourself? If you don't address that key mindset piece and the beliefs that you have about your environment and the beliefs that you hold about what you are capable of or what you're deserving of, it's going to be really challenging. So that's a key component that we also really pride ourselves in, is just taking the time to really understand each individual and what's driving these behaviors. It's always thoughts and emotions that drive your behavior. So if you want to change a behavior, you have to look back to that. So I hope that was helpful for you guys. I don't want to take too much of your time this evening. If you are interested in going back and looking at the past presentations that I've done on thyroid or gut health, just send me a message. I'm happy to send those over. I'll work on the recording for you guys. They'll be sent out tomorrow in your inbox, as well as all of the links to check out either my practice or the metabolic reset program or the meal plan and the seed cycling guide, as well as the Google chart. If you're interested in the glucose monitor, I will send you that chart too to log your details in there. Hope that was helpful. If you guys have any questions, please let me know. Thank you for joining, and we'll talk soon.